Hi, I'm Abby Lewis with Optometry Times. Today I'm speaking with Lindsay Elkins, OD, a fellow of the American Academy of Optometry and chair of optometric education at Southern College of Optometry. She's a longtime RAM volunteer and is here to talk to us about her experience and how other doctors can get involved. Can you walk me through what a typical RAM clinic looks like from your perspective? What kind of care are you providing, and how does it differ from a normal day at practice?
So the RAM clinics that I've had the pleasure to attend, there was one here locally in Memphis, and then a couple that are in Knoxville, Tennessee. And I think the ones in Knoxville are a larger event because it's close to their regional home. And so the clinic, it's massive. It's a huge undertaking of volunteers. The parking lot's so well coordinated, but you have staging areas where you check in as a volunteer. It's a giant group. I work at Southern College of Optometry, so we bring our students, our RAM volunteer students, and as many doctors as we can. We may be there with other volunteered doctors that are not associated with the school, but also other schools may be there. So for the optometry portion, usually it's a large area, but you're one section of that team. They have dentistry, nursing, a lot of areas there. So it's just a massive network of people that are working, but you also get to work with so many different people that you've never met before. As far as a typical day, and of course I work in academics, but where it's very structured, a person has a very set appointment, you're very rigid on your time. People line up around the block. Like the people that are there for care have been there for hours before you even get to start to see them. They get numbers and wait. So it's they're there waiting for you, and they're gonna be dedicated to the process all the way through. And also, they may have just gone to dentistry before they get to you, so they may have had several teeth pulled and other things that they've received care for. So it's challenging in some ways, but so rewarding as well, because you know that you really are being impactful for that. Especially our second day. The first day we get there probably 6 a.m. As a volunteer, and so again, people have been there, and the other volunteers that really get everything going, like they're waiting there for us. The volunteers do an amazing job. They have things so well organized. For someone just to come in and be able to share your expertise. The other people have already done so much of the groundwork. But yeah, from 6 a.m. till 4 p.m. and we could keep going. Honestly, the clinics that I've been at, there's no shortage of people that are willing to wait for that care, which is just an indication of how much the need is there. But it's so well organized, and there's just a lot of work to do, but a great group of people to work with and people to serve.
Is there a patient or moment from your time with RAM that stayed with you? Something that changed how you look at eye care and think about eye care access?
There's not just one. There are definitely multiple. A couple that stand out, are parents with their kids. So, and it may be that they're trying to get their child to be seen, or their whole family, or they're trying to actually get their own health taken care of. So there's been multiple situations where someone's trying to take care of an infant. They're having to breastfeed and take care of a lot of children, and they're just really wanting to get their eyes taken care of, which that can be a challenging situation no matter where you are for that family to just stick through just that waiting process, because kids don't wait very, very well, but the kids are so appreciative to be there, and the parents are so appreciative to have that opportunity to take care of themselves and their kids and just get this done. There's also been a couple of times where I actually had the same patient over that actually remembered me after the couple of years, and just being they were just willing to sit through that again and came to find me. Just so thankful for that opportunity, because they hadn't had glasses in years. And it's not just glasses care. There was at least one patient that they had swollen optic nerves once we dilated, so we were able to coordinate with RAM and local doctors as well to try and coordinate care afterwards. So it's not just a one and done type of event. When you go to a community, they get glasses, and there's no additional care set up there. So There's just been multiple of those times. And in a lot of these situations, if you had one person that remembered you or one person that was appreciative or this was impactful, it's just so many of them that it's hard to say that there's just one.
What does RAM tell us about eye care access in the country that people outside might not realize?
I think the demand, optometry and eye care services, especially if you're not in a rural area, um, it seems just very easy to procure. I think it's easy to take advantage of or underestimate just the need that's there. So it may not be that it may be that there's not an optometrist or an eye care provider within hours of where they live, or it's just not affordable. So it's not a one size fits all. Um, of just the care that they need and how people prioritize their care. If they have to choose getting glasses versus their blood pressure medication, there's hard choices people have to make. So the demand is just huge. In my schools in Memphis, Tennessee, we obviously have a lot. And being in a larger city, we have access to specialists. We have access to, it seems like optometrists wherever you would need it. So the access is there. So you forget about how much of the country is very rural and just doesn't have a provider. It doesn't necessarily mean ophthalmology, but optometry. There might be one in a county. They're not everywhere. There's the need for more care, but also access when it is there. It's just the affordability and having to prioritize the amount of time people are willing to wait for these services just highlights the huge need.
For an eye care
Yeah.
professional reading this or watching this video who's never volunteered with RAM before, what would you tell them and what's the best way for them to get started?
Well, RAM has a huge network. The remote area medical website, it makes it very accessible for newly interested parties to find out more information. They have lists of clinics that are in a lot of different regions. And if you're concerned about your licensing, a lot of times states will have a volunteer aspect to the license, specifically if you're volunteering your time. I do know several doctors that they only have the volunteer license. This is how they still give back in their community. They may be mostly retired or, it's a great way to network that way. For me, when you're a little bit younger, and you have kids and you want to do things with them, and it's hard to take these times. The last couple of times I've actually brought my kids with me now that they're older. When they were 14 and 17, the last couple years, they've come with me, and once your child is 14 years old, they can register as a volunteer. So of course they're not providing the medical services, but just the huge amount of need to volunteer, you can also make it a family event. Which my kids have really enjoyed. It also gives them some exposure to the healthcare community, but also just service and volunteering in general, and getting to learn from some of my mentors. So my 17-year-old had to learn how to do some data entry, and he informed me how terrible my handwriting is. That's okay. And my other son got to learn from the opticians how to help people pick out glasses. And I think it just helps make it a family event. So you're providing your care, but you can also bring your kids if they're old enough to, certain aspects there. But it's just incredibly rewarding. And the students that are there as well, a lot of times there will be staff, faculty, people that are not faculty members. They're general doctors. They also get to work. You get to network with people you wouldn't normally see, work with other professionals, and just very dedicated volunteers. And there's not anything that's more rewarding than the experiences I've had there as a professional. I am fortunate being at a school that we have a club, that's the Remote Area Medical Club. So usually when our students are also able to attend, they would coordinate a van that they take. I'd take my personal vehicle, and I'm not reimbursed for that, but RAM does provide us hotel locations that we can, if here in Memphis, of course, I would not use a hotel, but in Knoxville, that's about 5 hours away from me. So we would get there in such an early morning. So the hotels are provided. Even the first night that after the first day of clinic, like they had meals for us. So yeah, our accommodations are provided for. Usually there's food. They have breakfast there in the morning. They have lunch for us. So like you're taken care of while you're there. You're going to bring, they have equipment as well. My students usually bring some of their, like their BAO, some of their handheld equipment, but the phoropters, things are in charts and autorefractors. A lot of that equipment is already set up there. They have, the RAM coordinators do have that. So lenses and things our students would bring, but really they have everything. I usually don't have to bring any of my equipment. I bring myself, something comfortable to wear, and they provide you with all of this information so when I get that information from my students generally, but also now that I'm a registered volunteer, I get emails from RAM. They let me know when opportunities are coming up. And how to sign up for each of the different clinics should I want to, and they provide you all that information. They coordinate that for you once you sign up.